Did you have deadlifts today, or maybe you're lifting something at home, or maybe you're sitting too long or standing too long? You're starting to get that pain and ache, that tension, feel like you threw your back out on one side of your spine, that QL area, or maybe you're getting some sort of SI joint dysfunction. I want you to walk through these 7 steps to kind of loosen up that area, and hopefully we can relieve that tension and get you feeling a little bit better. We're going to start from the quadruped position, but before we jump into the cat camel, I want you to think about just the isolated movement between the pelvis and the lumbar spine. So from here, I'm thinking about keeping that neutral spine, and I just want you to tilt your pelvis into a posterior pelvic tilt. So I'm trying to point my butthole to the ground, and then from here, maintaining that neutral pelvis, dumping that lumbar spine, pointing my butthole into the air. When I say neutral spine, I'm referring to the spine above. So T-spine on the way up. Just trying to keep this flat back and isolate just the movement that's occurring with my lumbar spine. You may even have some relief by rocking back a little bit. So kind of rocking back into the hips and thinking the same thing. By being in this rock back position, it may give you a little bit of traction, so it may feel good on that lower back area as well. But I'm thinking that same context. Tilting my pelvis underneath me, tilting my butthole up to the sky. Tilting it underneath me, play with, you'll feel that tension, pointing it up. Just kind of going back and forth. Once we've done those a couple times, then we're going to go to more of that traditional cat camel, kind of working our way up that spine. So still starting with the pelvis and lumbar spine, but then working our way up. I like to add a big inhale at the top, kind of see if I can spread my ribs apart, theoretically. Exhale, dump it down. Go into that big extension curve. Inhale up, start with the pelvis. Inhale up. At the top, explore some nooks and crannies here. Kind of wiggle to the side, wiggle the pelvis. Push through the floor with different weight in each hand. Kind of push more with my left hand, push more with my right. Exhale, fall back down. Let's get a couple more. If this feels good, obviously you can always get a couple more. Push away the floor, tuck my pelvis underneath me. Exhale, drop back down. After we've worked those more traditional cat camels, now I want us to stay in this quadruped position, but work more lateral flexion extension, just kind of side bending. So just kind of drift to the side and just kind of going back and forth. Thinking about trying to open that side up as much as I can, feel that tension in that QL area, that quadratus lumborum. Maybe that area is the area that flared up. Maybe it's the SI area. Whatever it is, this normally sounds or tends to feel good when I'm working with clients and having them do that, if that area starts to get a lot of tension back there. Next, we're going to be in this rock back position, contouring around the ground, feeling that stretch in that QL area with those lateral bends again. So I'm going to be reached out overhead, elbows somewhat on the ground, and I'm just going to rock back and forth, feeling that stretch, getting as wide as I can. Hold that stretch just for a couple seconds, and then go to the other side. And we're just going to work back and forth, roughly 4, 5, 6 reps. If you want to get a couple more, go for it. Just feeling that lateral bend. I like to kind of add some tension into this, almost like I'm pushing and pulling on the ground and easing my hips back, kind of creating more of that lateral bend out of my side to see if I could put a little bit more tension on that tissue. Then I'm going to work my way up to this quadruped position, and I'm going to do some threading of the needle. So I'm going to take this right hand, I'm going to reach it through, feeling that tension across my backside of my body, and I'm going to push away the floor, and I'm going to reach straight up to the ceiling. I'm just going to get like 6-ish of these each side, feeling that tension, just kind of exploring it a little bit, seeing what feels good, trying to get a little bit deeper, get a little bit more out of this each time. So we started out by addressing that tension with the lumbar spine and the pelvis, seeing if we can ease up some of that tension, then rocked it back, see if we can create some more tension, almost like a form of traction as you get the pelvis underneath us, worked our way up the spine, kind of tilted, get a little bit more bend out of the QLs, and then we've opened up, involving that thoracic spine a little bit. Sometimes the way that tension's stored, we can kind of ease back, ease up, ease under, and just kind of play with tension as our body distributes it. Those are focused on a lot of movement that's occurring with the spine. Now we're going to kind of give some attention to that posterior capsule. From this quadruped position, I'm going to throw this right leg over, almost what it would look like with like a pigeon stretch. And I just want you to feel this tension across this left glute as seen here, almost like I'm trying to open that capsule up diagonally away from my body. And I'll kind of drift in and out of this, kind of ease to the side, and then drift right back into this capsule. Feel that stretch, drift out of it, to the side, drift back into that tension. You can hold it a little bit longer, a little bit deeper, feel that stretch, kind of add some tension of our upper body by rotating, whatever feels good. Next, I'll go to the seated setup, and I'm just going to throw my leg up over the side, and I'm going to feel this tension by getting into this externally rotated position, and I'm just going to fold forward, feeling that stretch. Remember, when we fold forward, I don't want you to crumple in the spine, but think about nice, tall, long spine, reaching. The second you pull upright, you should feel that tension back there kick on. Nice and tall, reach. If you're not quite there yet, or maybe it doesn't feel comfortable, we can grab this knee as a regression and just pull this into our chest. But once again, we're thinking as tall as possible with our posture, pulling it in. You can ease in and out of it. You can ease in and out of this stretch, or you can hold it, whatever feels comfortable. We had all that movement with the spine. Now we're kind of doing some attention to the hips with some stretching positions. Next, we're going to go to the standing position. I'm going to go outside leg forward. This is going to bring attention to the left QL. So if you're having problems with the right side, obviously we'd switch it up. From here, I'm going to think pin this right arm into the rack. You can use a wall, whatever you have. And then I'm going to go up and over with my other arm. From here, I'm thinking push away with my right hand and hold on for dear life with the left. So I'm pushing my hips away, feeling that tension along that left side light up quite a bit. So I've had success with having athletes hold this. I've had success with having them drift in and out. Just try to find a new spot each time. Don't just push out square. I'll have some rotation in the torso, rotation in the pelvis. Try to feel a different spot. Just play with that tension from this bow position. And even though you may only have problems with one side, if you are doing one side, there are definitely benefits I found from doing both. After you've done those 3 big stretches on the hips and the QL, go back to those first movements and kind of guide through those one more time. And as well, you can repeat this as many times as you want. I hope this helps.